Tinnitus, ringing, buzzing, hissing, or roaring in the ears, affects approximately 15% of the adult population worldwide, with significantly higher prevalence in people over 55, reaching 30% in that age group. It is a symptom, not a disease in itself. A symptom that always has a cause, and understanding that cause is the first step toward treating it effectively, or at least managing it. 2 critical alerts before beginning. First, tinnitus in one ear only, especially accompanied by hearing loss in that same ear, requires urgent medical evaluation to rule out acoustic neuroma, a benign tumor of the auditory nerve treatable when discovered early. Second, pulsatile tinnitus, that pulses at the rhythm of the heartbeat, can signal a serious vascular condition and requires immediate medical investigation. If you are not yet subscribed, click now on the subscribe button and turn on the bell. Tell me in the comments where you are watching from. Cause 1. Damage to cochlear hair cells by noise. The most common cause of tinnitus worldwide. Cochlear hair cells do not regenerate. Once damaged, the damage is permanent. Damaged cells generate spontaneous electrical activity that the brain interprets as sound. For people over 60 who worked in noisy environments, factories, construction, music, military, this is the most likely cause. Hearing protection in all noisy environments is the most important preventive measure. Cause 2. Age-related hearing loss, presbycusis. When the brain stops receiving normal auditory input from lost frequencies, it can fill the silence with spontaneous activity. The tinnitus. Hearing aids that amplify lost frequencies frequently reduce tinnitus significantly by restoring normal auditory input. Cause 3. Earwax buildup, one of the most easily resolvable causes of tinnitus. Professional removal of earwax frequently resolves tinnitus immediately and completely. Never use sharp objects in the ear. Use cotton swabs that push wax inward, or use ear candles. Cause 4. Eustachian tube dysfunction and middle ear infections. Chronic allergic rhinitis, chronic sinusitis, and other upper airway problems can maintain tinnitus as a recurring symptom while the underlying problem is untreated. After resolution of infection, tinnitus generally disappears. Cause 5. Ototoxic medications. Most relevant for adults over 60. Aspirin in high doses, NSAIDs in prolonged use, aminoglycoside antibiotics, loop diuretics like furosemide and cisplatin. If tinnitus started or worsened after beginning a new medication, communicate this to your doctor immediately. Tell me in the comments where you are watching. Turn on the bell. Cause 6. High blood pressure and cardiovascular problems. Pulsatile tinnitus is often of vascular origin. Uncontrolled hypertension can increase blood flow turbulence near the inner ear. When the vascular cause is treated, tinnitus often resolves. Medicare covers otolaryngology and audiology evaluations. Cause 7. Temporomandibular joint dysfunction, bruxism, and cervical tension. Somatosensory tinnitus can be modulated by jaw and neck movements. If the sound changes when clenching teeth, opening the mouth, or moving the neck, it likely has a somatosensory component. The 5 solutions. Solution 1. Complete audiological evaluation and treatment of the cause. Solution 2. Hearing aids when associated hearing loss is present. Reduce tinnitus in 50 to 80% of cases. Solution 3. Tinnitus retraining therapy, TRT, and sound therapy. Solution 4. Management of aggravating factors, sleep, stress, salt, caffeine, alcohol. Solution 5. Cognitive behavioral therapy for tinnitus. The suffering is proportional to the emotional response to the sound, not to its intensity. The role of the central nervous system. 2 people with identical audiograms can have totally different experiences with tinnitus. The difference is in the limbic system. When the brain classifies tinnitus as threat, it maintains the signal at high conscious processing, amplifying suffering. When it learns tinnitus is not a threat, suffering decreases dramatically, even if the sound continues. This is why CBT and TRT work without eliminating the sound. When to seek urgent medical care. Tinnitus in one ear with hearing loss. Pulsatile tinnitus, sudden onset after trauma, accompanied by intense vertigo, rapid worsening over days or weeks. 7 causes, 5 solutions. Ears that deserve attention. God bless you and give you much health. Until next time. The neuroanatomy of tinnitus. Why the brain invents sounds. The cochlea has approximately 15,000 outer and 3,500 inner hair cells, each tuned to a specific frequency. When cells of a given frequency are damaged, that frequency stops being sent to the brain. But the auditory cortex, accustomed to receiving input from that frequency, doesn't simply turn off. It begins generating spontaneous activity in the absence of input. It's like a radio station receiving no signal and beginning to generate static. That neural static is tinnitus. This mechanism, called maladaptive cortical plasticity, is the same that generates phantom limb pain in amputees. The 3 types of tinnitus and their diagnostic implications. Subjective tinnitus, most common, only the patient hears it. Cochlear, neurological, or somatosensory causes. Objective tinnitus, the physician can also hear it with instruments. Vascular or muscular causes. Pulsatile tinnitus, synchronized with the pulse. Vascular cause, requires immediate investigation with carotid Doppler and arteriography if indicated. Tinnitus retraining therapy, TRT. Protocol and results. TRT combines intensive directive counseling and sound therapy using broadband sound generators at volumes slightly below the tinnitus level. The goal is habituation, the neurological process by which the central nervous system reclassifies tinnitus as an irrelevant signal. Studies show habituation rates of 80% with correctly applied TRT over 12 to 18 months. The American context, tinnitus and hearing health policy. The CDC estimates 50 million Americans experience tinnitus, with 20 million having burdensome chronic tinnitus and 2 million debilitating. The American Tinnitus Association, ATA, provides resources for patients and funds research. The Veterans Administration has dedicated tinnitus programs. Tinnitus and hearing loss are the most common service-related disabilities among veterans. Medicare Part B covers audiological evaluations when ordered by a physician. For those without insurance, many audiology training programs offer reduced-cost evaluations. How to live better with tinnitus when it cannot be eliminated. Strategies that facilitate habituation. Avoid total silence. Use soft background sounds. Rain, fan, nature sounds. Maintain regular physical activity. Reduces sympathetic nervous system response. Practice mindfulness. Seek support from tinnitus patient groups. The American Tinnitus Association website, ata.org, has comprehensive resources. The silent epidemic of headphone-related hearing damage. The WHO estimates over 1 billion young and young adults are at risk of hearing loss from personal audio devices. The 60/60 rule. Maximum 60% of maximum volume for no more than 60 minutes consecutively. After 60, the ear is more vulnerable to noise damage. Hearing protectors at concerts and noisy environments are even more important at this age. The impact of tinnitus on mental health. Studies show patients with chronic tinnitus have significantly higher prevalence of anxiety, approximately 45%, depression, approximately 30%, and sleep disorders, approximately 50 to 70%. This association is bidirectional. Tinnitus worsens anxiety and sleep, but increased anxiety and sleep deprivation also worsen tinnitus. Ignoring tinnitus is not a neutral strategy. It frequently leads to worsening. Factors that aggravate tinnitus and how to control them. Caffeine, vasoconstrictor affecting cochlear microcirculation. Salt in excess worsens tinnitus in Meniere's disease and in hypertensives. Alcohol, vascular fluctuations affecting cochlear perfusion. Tobacco, vasoconstrictor reducing cochlear perfusion. Total silence, paradoxically amplifies tinnitus by making it the only available auditory stimulus. Controlling these factors can reduce perceived tinnitus intensity by 30 to 50% in sensitive individuals. FAQ about tinnitus. Can tinnitus disappear on its own? With temporary causes, infection, medication, wax, yes. With chronic cochlear damage, rarely disappears completely but can be habituated. Does caffeine worsen tinnitus? In many people, yes. Is there a definitive cure? For tinnitus from permanent cochlear damage, no current cure exists, but with proper management, most people can have excellent quality of life. 7 causes, 5 solutions. A life with tinnitus can be a full, happy life with proper management. God bless you and give you much health. Until next time. Cognitive behavioral therapy for tinnitus. How it works. CBT for tinnitus does not attempt to eliminate the sound. It attempts to change the patient's relationship with the sound. The central explanatory model. The suffering caused by tinnitus is not directly proportional to the sound's intensity. It is proportional to the automatic, negative thoughts about the sound. This will get worse. I'll go deaf. I'll never sleep well. And to the emotional response those thoughts generate. CBT identifies and challenges these automatic thoughts, replaces them with more realistic perspectives, and teaches relaxation techniques to reduce sympathetic activation that amplifies tinnitus perception. Studies show significant reduction in impact on quality of life, sleep, and anxiety, without change in sound intensity, promising new treatments under investigation. Repetitive transcranial magnetic stimulation, RTMS. Targeted stimulation over the auditory cortex has shown tinnitus reduction in some studies. Bimodal stimulation, combination of sound and peripheral nerve electrical stimulation, is being investigated to reset abnormal cortical activity. Gene therapy for cochlear cell regeneration, very early research, not clinically available, but promising long-term. None of these are currently standard treatment, but they represent real hope for the coming decades. Practical tips for daily life with tinnitus. For better sleep, use a white noise machine or nature sounds app at low volume. Keep consistent sleep schedule. Avoid going to bed in total silence. Consider pillows with integrated speakers. For better concentration during the day, work with soft instrumental background music that partially masks the tinnitus. Take regular breaks when concentration is affected. The invisible nature of tinnitus can make social situations difficult. It doesn't appear in blood tests or X-rays, but it is real, documentable in audiometry and validated questionnaires, and deserves the same attention as any other chronic symptom. A note on supplement claims. Many supplements are marketed for tinnitus. Ginkgo biloba, zinc, magnesium, B vitamins. The evidence for most is inconsistent and weak. Ginkgo biloba, multiple randomized trials found no significant benefit over placebo. Zinc, some benefit in zinc-deficient patients only. Magnesium, may protect against noise-induced hearing loss, but evidence for tinnitus treatment is limited. Spending money on unproven supplements diverts resources from approaches with actual evidence. TRT, CBT, audiological evaluation, and treatment of underlying causes. The correct attitude toward tinnitus. The title says, don't ignore it. And that's correct. But don't catastrophize either. The appropriate response to chronic tinnitus is not panic nor passive resignation. It is, investigate the cause with a competent professional. Treat what is treatable. Learn to manage what isn't. Protect ears from further damage. And remember that millions of people worldwide live full, happy lives with tinnitus. With correct management, tinnitus can move from the foreground to the background, from angst to indifference, from controlling life to being barely a footnote. 7 causes, 5 solutions. A tinnitus that with correct management can become irrelevant background. God bless you and give you much health. Until next time. Summary. 7 causes and 5 solutions at a glance. Cause 1. Noise-induced cochlear hair cell damage. Irreversible, but preventable. Use hearing protection. Cause 2. Presbycusis. Normal aging degeneration. Hearing aids frequently help. Cause 3. Impacted earwax. Completely reversible with professional removal. Cause 4. Eustachian tube dysfunction and infections. Treating the underlying condition resolves tinnitus. Cause 5. Ototoxic medications. Inform doctor of temporal correlation with tinnitus onset. Cause 6. Hypertension and cardiovascular problems. Pulsatile tinnitus requires urgent vascular investigation. Cause 7. TMJ dysfunction and bruxism. Somatosensory tinnitus. Dental/physiotherapy treatment. Solution 1. Audiological evaluation and cause treatment, the only causal pathway. Solution 2. Hearing aids for associated hearing loss. Solution 3. TRT and sound therapy, neurological habituation. Solution 4. Managing aggravating factors, sleep, stress, salt, caffeine, alcohol. Solution 5. CBT for tinnitus, modifying emotional response to sound. Tinnitus rarely disappears spontaneously when its cause is untreated. With correct diagnosis and management, most people can have excellent quality of life even with persistent tinnitus. God bless you and give you much health. Until next time. The relationship between tinnitus, hearing loss, and dementia risk. Emerging research has identified untreated hearing loss as one of the most significant modifiable risk factors for dementia. The 2020 Lancet Commission report placed it as the largest modifiable risk factor for dementia, accounting for approximately 8% of cases. Hearing loss causes reduced auditory input to the brain, increases cognitive load, the brain works harder to process degraded sound, and contributes to social isolation, all factors associated with accelerated cognitive decline. Tinnitus and hearing loss frequently coexist and have the same underlying cause. Treating the hearing loss, particularly with hearing aids, addresses not only the tinnitus in many cases, but also the broader risk to cognitive health. For adults over 60 with both tinnitus and measurable hearing loss, treating the hearing loss is not just about hearing better in social situations. It is a potential investment in long-term brain health. The American Academy of Audiology and the American Academy of Otolaryngology both now recommend periodic audiological evaluation for adults over 50. Medicare covers these evaluations when referred by a physician. Don't wait for the tinnitus to become unbearable or the hearing loss to become socially disabling before seeking evaluation. Earlier is better. 7 causes, 5 solutions. A hearing evaluation that can protect both your ears and your brain. God bless you and give you much health. Until next time. What to expect at an audiological evaluation for tinnitus? A comprehensive tinnitus evaluation typically includes pure tone audiometry, measures hearing threshold at different frequencies. Speech audiometry, measures ability to understand speech. Tinnitus matching, identifies the pitch and loudness of the tinnitus. Loudness discomfort levels, otoacoustic emissions, measures hair cell function, and possibly ABR, auditory brainstem response, if a neural cause is suspected. This battery of tests takes about 1 to 2 hours and provides a complete picture of the auditory system's function. Based on results, the audiologist and otolaryngologist can identify the likely cause, recommend treatment, hearing aids, TRT, medication review, ENT treatment, and establish a baseline for monitoring. The evaluation is not just for diagnosis, it provides the patient with objective understanding of their condition, which itself reduces the catastrophizing that amplifies tinnitus suffering. Many patients report feeling significantly better after their first comprehensive evaluation simply from understanding what is happening and knowing it has been assessed professionally. 7 causes, 5 solutions, a comprehensive evaluation that changes both the diagnosis and the experience of living with tinnitus. God bless you and give you much health. Until next time. Understanding the Tinnitus Handicap Inventory, THI, a validated self-assessment tool. The Tinnitus Handicap Inventory is a 25-question validated questionnaire used clinically to assess how much tinnitus affects quality of life. It measures 3 domains: functional, concentration, sleep, work; emotional, anxiety, depression, frustration; and catastrophic, fear of serious disease, despair. Patients score 0 to 100. 0 to 16 slight, 17 to 36 mild, 37 to 56 moderate, 57 to 76 severe, 77 to 100 catastrophic. The THI is valuable for several reasons. It quantifies the subjective experience objectively. It allows tracking of treatment response over time. It helps distinguish patients who need primarily audiological treatment, high functional impact, low emotional, from those who need primarily psychological support, high emotional/catastrophic, normal functional. And it validates the patient's experience. If you have access to the internet, you can find the THI online. Completing it before your first medical appointment provides useful information for your doctor and helps you articulate your experience. 7 causes, 5 solutions, an evaluation that validates and quantifies your experience with tinnitus. God bless you and give you much health. Until next time. For military veterans, tinnitus and VA benefits. Tinnitus and hearing loss are the most prevalent service-connected disabilities in the U.S. military, with tinnitus affecting over 2.5 million veterans. The VA provides comprehensive tinnitus evaluation and treatment, including TRT programs, CBT for tinnitus, audiological rehabilitation, and hearing aids. Veterans with service-connected tinnitus are entitled to disability compensation ratings. If you are a veteran with tinnitus who has not yet filed a VA claim, connecting with a veteran service organization can help navigate the claims process. The VA's Tinnitus Education Program, based on Progressive Tinnitus Management, PTM, has helped hundreds of thousands of veterans improve their quality of life with tinnitus. 7 causes, 5 solutions. For veterans, specialized resources and support that recognize the service-related nature of the condition. For everyone, ears are irreplaceable. Protect them, investigate when they signal distress, and don't let tinnitus define your life when proper management can move it to the background. God bless you and give you much health. Until next time. Final message: taking tinnitus seriously without catastrophizing. Tinnitus affects people differently at different times. During quiet moments, at night, during stressful periods, it can feel overwhelming. During engaging activities, social situations, and exercise, many people with significant tinnitus barely notice it. This variability is informative. It shows that attention and emotional state significantly modulate tinnitus perception. The most empowering realization for many tinnitus patients is: the sound is not in my control, but my relationship with the sound is. That relationship can be reshaped through the approaches described in this video. Don't ignore tinnitus, but also don't give it more power than it needs to have. Investigate, treat what's treatable, manage what isn't, protect your remaining hearing, live fully. God bless you and give you much health. Until next time, 7 causes, 5 solutions, one life that doesn't have to be defined by a sound. God bless you.